I'm Andy Flett. I'm a lecturer in health psychology, and my job principally involves teaching undergraduate medical students, so young people training to be doctors. And my training and background is in psychology, and I teach the elements of the curriculum which are principally about psychology applied to medicine. How can medical doctors make use of psychological theory and practice to improve the ways in which they treat their patients, the ways in which they understand how patients experience illness and becoming ill, the ways in which they deal with stress and pain, and the ways in which they develop addictions and how these might be treated, looking at ways of improving their communication skills through an understanding of psychology. And this is sometimes a little bit of a tough job, because a lot of the first year or 2 years of medicine are really kind of all about biomedical science, so understanding the body from very much a biomedical perspective, so things like anatomy and physiology and how cells work and what all the bones are and all the muscles are and all the nerves and all this sort of flesh and bones sort of stuff. And often that leaves our students at that stage with a very much a conception of medicine as being just a very much a scientific discipline, and being a doctor is just being a sort of applied scientist. And traditionally, quite often, they went through the whole of medical school without really conceiving of their job as being a doctor, as being a sort of dealing with people. And so we were left with a situation where we have practicing doctors who often aren't very good with people, they're not very good communicators, and indeed the number one reason why patients complain about their doctors is because of poor communication skills. So really that's the kind of rationale for my job and what it is, why I do what I do. This notion of the medical student and the doctors just being a scientist makes it tough for us sometimes to embark on teaching them models of psychology or sociology or ethics or sort of the wider public health and epidemiology stuff, because sometimes they conceive of that as being kind of fluffy or woolly or vague, or because it's not so much dealing in memorizing discrete facts about things, but it's understanding concepts and ideas and applying those to how people might behave or how societies might evolve or develop and happen in the real world. And one of the things I found when I started the job was that doing lectures and trying to teach, standing up and talking for an hour about the importance of health belief models, for example, which I can show you that we have, it's just a sort of standard diagram of how people make decisions, is interesting, but for our students they kind of often fail to see the connection between that type of model and the relevance to their future practice. And one thing that I discovered made a huge difference was using short video clips of patients talking about their own experience of developing illness and the experiences of consulting and having treatment and going through the whole sort of medical system. And to this end, there is a charity. It was originally called DIPEX, which is Database of Patients' Experiences, now called Health Talk Online. But they are a registered charity, and they have interviewed hundreds and hundreds of patients in their own homes on this very topic, discussing, what was it like when you first noticed some symptoms? What was it like when you first went to your doctor? What happened to you when you were admitted to hospital? What sort of treatment did you have? What was the outcome? What was the surgery like? How long has it taken you to recover, if they have recovered? So they have an online database of all these patients talking about their experience, and they're all in handy little 2 or 3 minute clips. And really it's designed for patients who have just been diagnosed with the same condition, so they can log online and find out more about what the experience of the illness is like. I mean, all patients now are actually very emancipated and they have the internet, they can find out lots about their condition. But there's lots of medical stuff out there, there's lots of stuff about what drugs do and what surgery is and what's the best options. But there actually has been relatively little about what it's actually like to have the disease or the illness or the condition. So this is a fantastic resource, and when I discovered it I thought this is great because it actually is it makes a connection between the theories I'm talking about and the relevance to the medical professional in helping them understand the experience from the perspective of the patient. So what I do is within lectures I'll talk about the health belief model. I'll say, you know, a patient's propensity to take action if they notice some symptoms is based on several different factors, you know, how severe it is, how unusual it is it interrupting with their day-to-day life, does it stopping them going to work or looking after the kids or whatever, and then I'll show them some of these clips, and it's people describing these various things. You know, it's the same, it really sort of it paints a picture of the theory, which I think goes an awful long way to helping the students understand the relevance and the place for what we teach within the medical curriculum.